Hi, everyone, and welcome to another edition in our virtual health fair. Today we have Miss Natasha Yeste Delaney with us from UHC, and she's going to be talking to us about hospice and what it is and just answer some questions about it. So, thank you so much for being here.
Thank you for having me.
Alrighty, we'll jump right in. Can you tell us basically what is hospice?
Hospice is a type of care that focuses more so on like the end of life services. We really focus on the quality of life and focus for patients that have a terminal illness or that they have an illness that they are no longer either responding to treatments or treatments are no longer available. And we just really, with hospice, focus on providing comfort and support for the patients and for their families through this delicate time until the patient would pass away.
That's awesome. And how long has the hospice organization that you work for been in operation?
We've actually been in operation for over 30 years. Initially, we started out as People's Hospice, and then we have now transitioned into WVU Medicine Hospice through United Hospital Center.
Alrighty, that's great. And when should a patient or a family member start to talk about hospice or ask about hospice for themselves or for their loved one?
Okay, really, we look at the earlier the better to have a referral to us. So if a patient or a loved one sees that their family member is declining more and not responding or having problems getting around and the quality of life is starting to decline, those are always good times to bring up that conversation with our primary care provider to just see if it would be an option. And if we, for some reason, would, because there are certain restrictions that we have as far as who is appropriate for hospice services. So if you have a patient that might not necessarily meet criteria at that time, there are other programs that are available. We have our Hospice Bridge program that actually is for patients who are established with home health who quite aren't under our criteria yet, but are able to kind of be monitored under our service. So then that way, when they do meet criteria, we are able to bridge them over.
Alrighty. And what are some payment options for hospice?
The good thing about hospice is most private insurances. I'm sorry. Most private insurances actually pay for services at 100%, and Medicaid and Medicare are accepted as well. The good thing with our hospice, we pretty much accept any type of insurance, as well as we have our charity option that's available because our goal really is that our families don't have to receive a bill at the end of the service.
That's important. And so, how long is hospice at UHC, and what healthcare members are part of hospice?
Um, with hospice, currently our census is we're carrying over 100 patients. And we actually have two different offices. We have our main office that's here in Clarksburg, and then we also have a sister branch office that's in Kaiser. Our office covers Harrison, Doddridge, Marion, Mon, Lewis, Upshur, Taylor, Wetzel, and Barber County. And then, of course, Kaiser, they cover the Mineral County. And then we have under service for our organization, we have our medical director, we have nurses, we have LPNs, we have aides, we have social workers, chaplains, volunteers, and we even offer therapy services. So we have physical therapists, occupational therapists, speech therapists. So we have a wide array of a support team for our patients.
It's really just everyone working together.
Yes.
Great. And so, what is the expectation about the family's role in caregiving when their loved one is has chosen hospice?
Really, the families do take a large role in the caregiving process. They are the ones that are primarily there administering medications, helping to provide, more so of that individualized care and like hygiene needs and things like that. But of course, we work very closely with our families to help prepare them for caring for their loved ones. So we teach them about the medications, we teach them about transitions, and we actually have a transitions booklet that we give them that reviews the things to expect as a patient, as their loved one is passing away.
And what kind of bereavement services does hospice offer?
We actually have multiple bereavement services. That's something that we try um, to make sure that we stay close to our families after the time of passing. We do monthly follow-ups, um, and that's as simple as giving them a call. We do mail out bereavement packages as well that just kind of has like words of encouragement or steps to take through the grieving process. We offer a monthly group counseling, and we have through the COVID, we haven't been able to have our in-person meetings, but we still have our call-in number that we do, and that's the first Tuesday of the month that we do that. And then we have individual counseling that's available as well.
That's great. That's so great. And can you share a story that has stood out to you during your time with hospice?
Yes, I've actually been with hospice. It's almost 8 years now. And I started out just as a weekend nurse and have moved on up to be the director of hospice now. But, really a story that sticks out is a personal story of mine for this family that I had been taking care of. And really, you come into these people's homes and you get welcomed and they become much like your family. So it was something that I always look forward to going to visit with this family. And my patient and I shared a love of Operation Christmas Child shoe boxes. So that was like really our connecting point. And when she found out that I was going to the processing center, and we were packing boxes to get ready to do that, and she started telling me the story about when her cancer was at the point that it got so bad that she couldn't pack shoe boxes anymore. So my family and we packed 20 boxes just for her. And I took pictures of the kids packing the boxes, and I brought her the pictures, and I said, and we put a note in there saying that these were packed with love in honor of her. And I took her the pictures of the kids packing the shoe boxes. And actually, she kept a picture of my kids in her living room, packing those with the shoe boxes. And actually, when you fast forward, when she passed away, and of course I attended her funeral as well, just because I had become so close with the family. But then you fast forward, it was about 4 years after she had passed, and my family experienced a tragic loss with my sister passing away with leukemia. And my patient's husband ended up coming to the viewing of my sister, and just because like we hadn't even really been in much contact with each other after that, just occasionally I would call and just check in on him. But he showed up at my sister's viewing, and he said, "You supported us so much through everything that we went through with her, and I wanted to make sure that I came to show you that we still love you as a part of our family too." So that's the amazing part of hospice, is because you do become family to these patients that we're taking care of, and they look to us for support. And ultimately we enjoy going out and seeing them and becoming a part of their family as well.
That's so special. Thank you for sharing that. I just got goosebumps. That was a good story. And then I have one final question for you. You touched on it earlier, but how has the pandemic affected your ability to provide services?
Really, for our in-home services, it really hasn't affected us too much. We just use our appropriate PPE and are able to provide care as we were prior to the pandemic. Of course, we've had some limitations. Some families are a little bit more hesitant to let us in to the home. So for those families, of course, we respected their wishes and either cut down their visits to just the as needed, or however they wanted to take care of that. For those that let us come as normal, we came as normal. Our biggest effect really had been for our nursing facilities, because nursing facilities had shut down to us for a long time. So we were just trying to perform virtual visits for our patients. And then, of course, for some of our support groups and things like that. We hadn't been able to meet in person for those. So we just tried to arrange that we can do telephone calls and things like that. So it's been an adjustment for sure.
It's definitely been an adjustment for us all.
Yes.
Well, do you have anything you'd like to add?
I don't think so. I just appreciate you guys having me today.
And thank you so much for coming. It was great to learn.
Well,